This video will introduce you to some of the anatomical terms that we'll be using throughout the semester. This first slide here is on the general anatomical position. It's kind of the what we use as the baseline when we talk about anatomy. So that you should know the anatomical position. It's essentially a person that is standing at attention. It's very important that they're standing upright. Their feet are parallel and on the floor, as you can see in this image. The head is level and looking straight forward. Arms are at the side. And most importantly, the palms are facing forward and the thumbs are away from the body. And the term we're going to use for away from the body is lateral. And that will make sense in the upcoming slides. Another thing that we use when we're talking about anatomy, and especially when we're looking at different images throughout the body, we use planes or sections. And the first one is called a coronal plane, also called a frontal plane. And this coronal or frontal plane divides the body into front sections, which we call anterior, and posterior sections, which are the back sections. So you need to know the term anterior and posterior. The best way to learn these is to relate them to the everyday terms that you know, like front and back. The second plane is what we will use to divide the body into superior and inferior sections, which would be upper and lower sections. This is what's called a transverse plane, and it's also called a horizontal plane. The next one is a mid-sagittal plane, which is called a median plane. It divides the body exactly in the middle. The mid-sagittal plane is going to divide the body into equal and left and right halves. And there's other sagittal planes that will also divide the body, but they're going to be unequal planes. And we tend to call those parasagittal. And we say parasagittal because they are parallel to the median plane or the mid-sagittal plane. Now, terminology is very important in anatomy, and I don't want you to get confused median with the directional term, which is medial. So there's only a difference of one letter in this, but it's quite different. The last plane or section that we're going to talk about here on this slide is an oblique plane, and it passes through a specimen at an angle. So you'll need to be able to use these terms in different examples. When we consider correct anatomical position and body planes, you'll see examples of these different planes. With this model, we can see an example of the coronal plane, which is also called the frontal plane. As you can see in this example, we can visualize the brain such that you can see different images of the brain here, different parts of the brain, which is quite interesting. It also shows where that coronal plane would be dividing the skull. The next plane is the transverse plane, which is going to divide the body into superior and inferior sections. The last one is the mid-sagittal plane, which, as you can see down here, gives us a view of a different angle, and it divides the body into right and left halves. And we've already seen the transverse section dividing the body into superior and inferior sections. So all this is important because we can visualize anatomy in three-dimensional sections, which is really, really important. This is a view of the small intestine, and each single section may misrepresent the complete structure of the object. So we have to keep that in mind. However, what we're looking at here are essentially sections of this. So for example, This would be a transverse section of the small intestine. But now, since the small intestine tends to snake around, we see other sections as well. So when we talk about anatomical directions, it's important for you to know these terms, especially the ones that are in bold. They help to relate different structures of the body. And for example, they would be used when you are charting information about a patient in order to relate different body regions. So the anterior region is the front region, the posterior region is the back region. So we would use these to complete sentences when we're relating two parts of the body. For example, the heart is posterior to the sternum. So again, as I mentioned before, utilize the everyday term that you know first, which is back. So the heart would be behind the sternum, and you'll replace behind with posterior until you get to use that terminology. We could also reverse this and say that the sternum is in front of the heart. Therefore, the sternum is anterior to the heart. The next directional term is superior, which is towards the head. Inferior is towards the feet. And sometimes the term caudal is used towards the tail. We're not going to use this much in this class, but cranial is towards the head. The term cranial, dorsal, ventral are more commonly used for cavities, which will be discussed coming up. The next directional term is medial, which is toward the midline, and lateral is away from the midline. So as I mentioned, in correct anatomical position, the thumb should be lateral to the pinky, for example. Under mediolateral, we also have the term ipsilateral, which means the same side. So you would say that the right ear is ipsilateral to the right hip. If they're on opposite sides of the body, we would utilize contralateral, which is on the opposite side. When we are describing different layers of the body, like the skin versus the muscles, we'll use the term deep, which is like internal, or superficial, which is like external. So you would say, for example, that the skin is superficial to the muscles. You could also reverse this and you could say that the muscles are deep to the skin. The last directional term is what we use only for the limbs. Proximal means close to the trunk, and distal means far away from the trunk. And just to remind you, this is only for the limbs. So when we're talking about comparing two things on the arm, for example, the shoulder is the most proximal region. When we talk about the lower limb, the hip is the most proximal region. So to give you examples of this, in this specific model, we can see that this arrow is pointing anterior. So this is the anterior surface of this person. This arrow is pointing posterior. So this is the posterior side of the of the specimen. So for example, the gluteal region, which as most of you probably know is the buttock, is a posterior body landmark. In this example, the arrow is indicating superior, so the head is superior to the abdomen. In the opposite direction, we have inferior, so the abdomen would be inferior to the head.